voice, tone, etc. How you communicate with your patient should match what you're saying. This is called congruence. However, if your tone or body language does not match your words, this causes confusion and is known as incongruence. We are going to show you the best way to reach your patient as well as giving tips on things to avoid. To show empathy and interest, make aware that your presence is there for your patient. This will let the patient know that they don't have to act out to receive attention.
Hi, how are you today?
I don't really feel like talking. I'm not really looking forward to my chemotherapy.
Well, it's okay. I can stay right here and wait for your family. Feeling okay?
Actually, my chest hurts a little bit. I think I need help.
Nurses can verbalize any observation they make. It helps know awareness. Make sure to refrain from judgment.
Okay.
I noticed your breathing seems labored. Are you feeling okay?
Actually, my chest hurts a little bit. I think I need help.
There are two types of questions, open and closed. Open questions leave a lot of room for a lengthy response. It allows patients to clarify their thoughts and voice their attitudes, concerns, and their feelings. Closed questions just leave very little room for a response.
How are you feeling today? Is there anything I can do for you?
Are you?
Is your back bothering you today? When's your family coming today?
Verbal communication can be therapeutic for the patient if done correctly. However, there are some things you should try to avoid. Next are examples of probing, advising, false reassurance, and changing the subject.
Did you talk today?
Why? Is it because you refuse to make amends with your son?
Probing may offend the patient and makes it seem like you're prying. Try to suppress your curiosity because it ultimately doesn't help the patient. Try to ask questions that focus on finding out what ails them.
I'm afraid to tell you the cancer has spread to your lungs.
Well, I like to have it done the natural way. I don't want to put myself through chemotherapy.
Well, if I was you, I would listen to what the doctor and I recommended. If it was me, I would do it in a heartbeat.
Advising pushes your beliefs on the patient and doesn't actually give them any information. It suggests that they are incapable of making their own decisions.
I'm already diet. I have so much work to do that I haven't got to do yet. Don't worry, you'll be fine. I just get some rest so you can get all better.
False reassurance suggests that there is no need for any anxiety and belittles the patient's feelings. It is basically lying to them and should be avoided at all costs. As we all know, verbal communication is only a small fraction of how we get a message across. There are hundreds of other cues that we give off outside of simply speaking. Body language, eye contact, personal space, and voice tone are just some of the things that can either help or hinder a nurse's ability to get through to her patient. Different situations require that we adjust our communication accordingly. Sometimes it's difficult to keep track of every movement that you are making. However, there are some simple things that you can keep in mind to maximize communication.
This body language is called the bully stance. It is to be avoided at all costs. You may think it makes you look in charge, however, it is intimidating to the patient. This makes them less likely to talk, and therefore is detrimental to the healing process. Instead, go down on their level. This may be useful when talking to little kids or someone confined to a wheelchair. If someone is simply sitting down, sit next to them, but keep your body at a 90-degree angle. If you do want to show that you are a professional and expert, just face your hands downwards. This is more effective than having your palms facing upwards. Encouraging the patient to ask questions may be difficult, so try having your palms facing down while maintaining eye contact. A smile and nodding your head will show them that you are ready to listen. Simply having a prop with you will not convey the expertise you were hoping it would. Instead, it can help you deliver bad news. People's first reaction to hearing bad news is to sharply inhale and momentarily stop breathing. This is where the prop comes in. Instead of maintaining eye contact with them, look somewhere else, like down at your clipboard. If you keep looking at them, they may feel rushed to think of a response or embarrassed of their reaction. Stay silent until you notice their normal breathing has come back. This is a sign that they are ready to think about what they have just been told.
Nom 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 nom